Proteins are essential to your health, and because we cannot store them, we need to eat adequate amounts of protein every day. In this module, we discuss your protein requirements after bariatric surgery and look at some of the ways you'll be sure that you are reaching your protein goals with each meal.
The goals for protein intake on the duodenal switch patient is a minimum of 80 to 100 grams of protein per day. This is where we will start, 80 to 100. Based on lab results and based on your lean body mass after surgery, we might actually increase that protein, but there is a minimum of 80 to 100 grams per day. You need to take in 3 protein shakes every day for the first 3 months after surgery to help meet these goals.
So when you start shopping for protein supplements, there's a couple of things that you need to know about. The first thing is that you want to look for a whey protein supplement. You want to avoid a collagen-based protein supplement. Collagen is not a complete protein, and so you can become malnourished very quickly after surgery if you're consuming a collagen-based protein.
One of the very important things after your surgery will be to make sure you're consuming enough protein. And protein can come in a lot of different forms. Some are going to be easier for your body to digest and assimilate, and for that reason, we will generally recommend that you use a protein supplement that is going to be proteins that your body will be able to absorb more readily. In addition to that, you'll want to try to make sure that as you eat your meals that you consume the protein-rich foods first so that you don't fill up your stomach with foods that don't have protein. Your body doesn't really have the ability to store protein other than you have protein in your muscles and other tissues. So as opposed to sugars and fats, which you do have stores, with protein, if you are not getting enough protein, then your body will begin to break down what we call lean body mass, and that's something we don't really want to happen because it can lead to muscle wasting, atrophy, loss of strength, a loss of stamina, and just general fatigue. If the protein malnutrition becomes rather advanced, it can affect other essential function in your body, such as the immune system, the ability to repair tissue, healing wounds, and things like that. In terms of monitoring for protein deficiency or protein malnutrition, the earliest symptoms are going to be more along the lines of fatigue, maybe hair shedding or hair breakage. But the most important thing we can do is check levels. And so if you feel that you're not getting enough protein in, then it's easy enough to do some lab tests and kind of check and see where you are.
You want to choose a protein shake that is bariatric quality. What we mean by this is that the protein shake will break down quickly within your body, so your body will absorb all the protein that's in the shake. You want to purchase protein shakes that are whey protein isolates. Isolate whey protein will cause less GI distress. You want to avoid collagen-based and concentrated protein shakes. These will cause increased GI distress. Read your label. Look for protein shakes that have a minimum of 30 grams of protein per shake and have less than 10 grams of carb or sugar per shake.
Let's take a moment to review this module. You need 30 grams of protein in each meal. Use a whey protein supplement, not a collagen-based one. Your protein supplement should have less than 10 grams of carbohydrate in each serving. Get into the habit of tracking your protein intake. If you are not sure if your protein supplement is adequate, please ask us. There are additional resources available for you to download if you would like more detailed information on this module. When you are ready to continue, use the menu on the left to select the next module.